Let's talk about hand expression. So, hand expression is a skill that moms can learn to help express milk, whether it's in the early days with colostrum or even after once their mature milk is in, to help remove milk when they're not able to by latching baby or being near a pump. Um, and it can really be helpful in those early days when the colostrum's still in, and either they need to help entice baby to latch by doing some hand expression to firm up the nipple and bring some colostrum down, or if baby's not latching and they need to remove some colostrum, sometimes it can work better than the pump in the early days too. So there's a couple different ways that hand expression can be done. Most people feel that it's just, we're going to go to a breast model here, that it's just kind of squeezing the nipple forward. And it's not just that simple forward motion. Sometimes if the milk is in really well or like, full and engorged, you might be able to, but really we need to work on getting behind those ducts to really try to work the milk out. So when you have a mom that needs to learn hand expression, you're going to teach her these steps. So first, you want her to just get relaxed, get comfortable, and gently massage the breasts to get them ready. So either like a fingertip massage or like gentle kind of squeezing here and there, but never painful. Always to their comfort. Pain is just going to inhibit the letdown reflex, so we want to avoid painfulness. So massage the breast, get it ready. And then you're going to instruct her to use a C shape with the palm towards her body. So not outwards like this, palm towards her body in a C shape. And you want her fingers to land about 2 fingers from the nipple on either side. Sometimes this is right around the areola, the edge of the areola. Sometimes it might be beyond, depending on her anatomy. Everyone's anatomy is different. So, but you do want the fingers kind of opposite of each other in a nice C shape. The next thing we're going to do, before we squeeze anything forward, we're going to push that skin back towards the chest wall to try to bring those fingers behind the ducts. So the skin gets pushed back, and then you're going to squeeze forward gently and roll the tissue towards the nipple. So we're trying to get those ducts kind of moving forward to help milk that milk out. So pushing the tissue back towards the chest wall, and then gently rolling and squeezing towards the nipple. So this motion, your hand is moving the tissue, but your hand is not moving on the tissue. In other words, we're not moving our hand to physically move it back and forward, like on the outside or slipping and sliding on the tissue. We're keeping our hand almost stationary, but making the tissue do the work, moving backwards and then rolling forwards. You want to do this motion, well, it depends, it can vary, but you're going to do a good few times this, like east to west, side to side. You may then change the angle working around the clock. It may take several minutes in those early days to get things flowing with the colostrum because it is that super thick and sticky kind of liquid instead of the more flowing milk, like watery kind of liquid. But patience, perseverance, and technique can really make a difference. Once mom gets really good at it, then they can do it almost anywhere, anytime. But it can be a challenge at first, and it's not always instinctual. So having that education, using videos, handouts, things like that, and like just even showing on a model sometimes, or helping them practice on themselves if they're open to that, can be really helpful because it's sometimes a difficult idea to have as an abstract. But it can really be beneficial, especially if we're struggling to latch or if we're not latching and we need to get that colostrum removed so we can get the milk production going. So if you have any questions or want to practice on one of the breast models, or we have a crochet model too, it's just a little bit harder to show that motion on here, then just let us know. I will be happy to go over it with you.